But let's remind our listeners and the people watching your backstory. I find it so interesting. You found some of this stuff way before its time. How did you kind of get back into learning about ketogenic diets, and what was the process like of wondering, like, is this safe? Can I do this? What is this thing? It was just in a time that you found some of this stuff where there weren't a ton of resources out there.
Yeah, so when I first started keto, and I probably told this story before, so I'll keep this part short, but it was when I was at University of Michigan and applying for a job, and then like, can you do ketogenic diets? And like, I've heard of that. And that was about it. And like, yeah, I can learn anything. And so ended up getting the job working with keto for epilepsy. And it went against, I say get against, it was just a very unusual diet for a dietitian to be saying, hey, eat lots of fat, and then giving people these, huge, large amounts of fat. And I really honestly didn't really love it at first because I didn't know anything about it, which is why I really love education on keto now, because it's really, it can be hard at the beginning when you really don't understand. So anyway, as I learned more and I was kind of trying to get out of doing it at U of M, I started seeing people get better with epilepsy. I started seeing these kids, and my favorite line ever, I say it all the time, is when a parent looks at me and says, I got my kid back. And now I have adults say that, 60-year-old parents about their 30-year-old children saying, I got my kid back in the mental health space. So it's amazing. It's the same thing. It's exactly the same thing. Anyway, so I started out in epilepsy, which was a well-established field, although in the 90s and early 2000s, it was really coming up and really growing because of the Charlie Foundation. They just absolutely, created this huge boost, this huge resurgence of the ketogenic diet, because it was almost dead for epilepsy. And basically, and they brought it back. And so, I say they brought it back. Hopkins was still doing it. Mayo Clinic was doing it. U of M was doing it. Spatterings of people were doing it, but they blew it up. And so through the Charlie Foundation, you have this initial bunch of research on epilepsy. And then fast forward into the, early 2000s, and to get the dates on some of the articles, but you see some people doing it for cancer, and then a little bit for schizophrenia and bipolar, and just gradually seeing these silos of work coming up in different areas. And then move up to, gosh, if it was 2021, maybe, no, probably even before that, 1920, I can't remember, when the Bazooki's discovered it with the ones who established Metabolic Mind, who have now done, all that the Charlie Foundation did and more, have exploded keto for mental health, because what they've done is all these people that were working in these areas in silos, they brought them all together and said, hey, you people all around the world, let's get in one room and let's talk about keto for mental health, and let's see what's working, because we saw it work for our son. So let's do this. And so they've done that over the past 3 or 4 years, and they've just created an amazing nonprofit organization, and they're just funding research and doing so much. So that's exploded. So as far as where I started out, just in all that, it was just this natural progression of, keto for epilepsy, that's established, and then people for cancer, and then migraines, and then McArdle's disease, and just these different things that kept coming up that were outside the usual. And then I kind of had the opportunity to say, wow, I either have to work 2 full-time jobs, which I never wanted, or I could kind of lean away from the hospital and go over here and work in private practice, where I can help all these other conditions. And so that's what I did about 9 years ago, left the hospital and have been just fully private practice. And then what would happen is, like, I'm working 1,000,000 hours. I can't see all these people. So I bring on another dietitian. So now we have 10 dietitians, 1 physician who's a PhD in nutrition also on my team, and we're seeing people all over the world. So it's been just this really nice, slow growth progression, and just trying to help people, one at a time, which then leads us to what we're doing today, which is trying to help many at a time, along with the one-on-ones.
That's amazing. You and I met in 2024 at Dave Feldman's conference, the Citizen Scientist Conference, and it wasn't obvious to me in the beginning, and it should have been. I should have caught on to this a little bit early, but I thought it was an interesting kind of cross between people that were interested in cholesterol, but also a bunch of people that were interested in mental health. And I kind of saw them as like, oh, there's these two groups of people, but I missed initially like the convergence of like, oh yeah, of course there's going to be a huge convergence of people with mental health and also concerns about cholesterol together, because we're learning, you know, what can happen to a subset of people that go on a ketogenic diet. They might have an increase in their cholesterol and they're, you know, concerned about it and they want to figure those things out. And so it is cool that you see the families like the Bazukis that have done incredible amounts of work, poured so much money into the research. You missed the 2024 Symposium for Metabolic Health in San Diego. And as I've been asking people who have attended that conference what their favorite highlight was, we had an entire day, the whole Thursday was all presentations about mental health and keto. And it was absolutely wonderful, whether you wanted to talk about schizophrenia, bipolar, different kinds of diets, some carnivore, some vegetarian, and also getting down to like anorexia nervosa, a presentation given by Guido Frank, who's not even like really a low carbohydrate guy, but explaining all these mechanisms and how this can actually improve what anybody would say you should never put a restricted diet on. It's really fascinating that this field is going, you know, it just seems to be like exploding. We're learning so much more every single day. That must be cool to be in your position and see it be just a little trickle when you first started and just drinking from the fire hose now.
So it is. So it's so cool. Well, you mentioned Dr. Frank. So our team's working on his next study. So he's already published one study. And their dietitian Shannon Kilty, who's amazing at UC San Diego, did that one. But our team was already in place to do the second study. So several of us are meeting with the patients with anorexia, and it's you know, we're doing a lot of the same things. I mean, we have different sensitivities with anorexia and different things. We literally just ask the patients, what should we not say to you? You know, please tell me what your triggers are. Please tell me the things that are going to, you know, that we need to not say, because it's going to be different for everybody. So yeah, there are 3 of us on my team. We're keeping that tight, you know, to have good, you know, continuity would be the word for that. So we're working with that. We're working with a study at Mass General, McLean on a study. We're working with another one, UCLA. And so those are just, and I'm sorry, I hope I don't sound like I'm bragging, but it's just, I'm honestly just humbled by the opportunities to do that and to be in a place where we also can provide, you know, kind of a group that, you know, we have a team of dietitians that are all like-minded. And so we can, you know, provide a bigger level of support and support the number of patients. So oh my gosh, there's another really exciting study coming out. So I don't know if I can talk about that one, but it's coming out soon and it's going to be great. We're going to train the trainers. I'll leave it there and you
Amazing.
can have,
What a tease. What a tease.